By the way, I hope you like this background. So this is at my parents' home. My mother is a fan of all these plants, and this is her one of her favorite plants. Hi, hope you guys are all doing good. First of all, apologies for not being able to post the subsequent parts of paper discussion videos because of some personal challenges. I had to delay it by some 24 to 48 hours, and this will be our eighth part. I could squeeze out some time from my schedule and a lot time towards this paper discussion. So I hope you'll understand. As you know, my mother's health is not really in good condition, and based on her recent blood test report, her hemoglobin is falling further, and her creatinine levels are rising at an alarming rate. And we're planning for dialysis this week. So it'll be her first dialysis, and we're just hoping for the best. The challenge here is she has ITP, so platelets are around 10 to 15,000. So she has to be hospitalized, and then her blood things have to be taken care of, and then we have to go for this invasive procedure and dialysis. So just hoping for the best, just looking at one thing at a time. It's been very challenging, but you know, what can we do? We can only do something from our side, even though not everything is under our control 100%. Isn't it? I'm talking about extrinsic factors. But it is during these challenging times that it's obvious that what's happening in here is definitely in our control 100%. So I hope you guys are ready. So let's jump into this paper discussion video, part 8. Okay, now let's move on to the first topic in this specific video. So these are the keywords which I received: pH of gingival displacement agents. So in case of gingival retraction, we use certain chemicals. And I think the question was related to pH of those chemicals, if I'm not wrong. And as you know, the protocol, let me know if you need any further clarification. So based on literature review, as we can see, the pH of gingival displacement agents is commonly in acidic range, and it is in the range of 0.7 to 2, so based on some reference articles, as you can see in this particular slide. So mechanico-chemical means or chemomechanical means of gingival retraction, we employ certain chemicals along with gingival retraction cord. So these chemicals, they act as hemostatic agents or astringents, and they have their own importance during gingival retraction, which is very much important to record that critical cervical area of tooth preparation. And I'm sure once you enter into post-graduation, you'll appreciate the same. And once you are into clinical practice, you'll enjoy the same, right? So I hope this information is suffice. Now let's move on to the next topic. So soap bubble appearances, those are the keywords which I received. So a left illustration, top left, you can see the radiographic picture of a lesion is often distinctive in case of aneurysmal bone cyst. So the bone is expanded, appears cystic with honeycomb or soap bubble appearance in many cases, and is eccentrically ballooned, as you can see in the radiograph. Maxillary occlusive, right? And then in case of bottom right illustration, so that's giant cell tumor, again with soap bubble appearance. So giant cell tumors or osteoclastomas of bone tend to be lytic and expansile, being surrounded by thin shell of bone, resulting in a soap bubble appearance radiologically. So they typically arise the ends of long bones, as we can see in this radiograph. Consider this soap bubble appearance very, very important, right? Now let's move on to the next topic. Suicide inhibition is the keyword which I received. We discussed the same in our e-classes and also in study club discussions several times, if you remember. So there are two or three contexts which I would like to discuss. As you can see, in case of clavulanic acid action, there is suicide inhibition, as you can clearly see in the literature given in Tripathi. Clavulanic acid is a progressive inhibitor binding with beta-lactamase, is reversible initially, but becomes covalent later. Inhibition increases with time, so called a suicide inhibitor. It gets inactivated after binding to the enzyme, right? Now, in the context, in another context, also we have suicide inhibition as given in such an arena, biochemistry. Suicide inhibition is a specialized form of irreversible inhibition. So you have some examples: allopurinol. Allopurinol, an inhibitor of xanthine oxidase, gets converted to L-xanthine, a more effective inhibitor of this enzyme. If you remember, we discussed this in one of the study club discussions as well. And also we have a few more examples. Okay. Now, let's move on to the next topic. Lobes in premolars. These are the keywords which I received. So as you can see, literature review from Wheeler. Maxillary premolars are developed from the same number of lobes as anterior teeth, that is 4. And mandibular first premolars are developed from 4 lobes as in case of maxillary premolars. And also, most importantly, mandibular second premolar in most instances are developed from 5 lobes, that is 3 buccal and 2 lingual. Okay, consider this important and I hope this information is helpful. Now moving on to the next topic, baseplate wax, the type of wax used in tropics. So those are the keywords which I received. Let's review some information. A dental wax containing mostly wax, resin and different types of additives used chiefly to establish initial arch form in making trial plates for arrangement of artificial denture teeth and for construction of complete dentures. I'm sure most all of us would have used the same during our undergraduation, unless until you're a very bad student where you want or you make your friend do all this work. Okay, I'm just kidding. So we have a classification based on the hardness of these baseplate waxes. Class 1 soft, class 2 hard, class 3 extra hard as given by the manufacturer. The harder varieties are suitable for use in warm climates but tend to crack and flake at low temperatures. On the other hand, the softer series are suitable for use at low temperatures but may flow excessively at very high temperatures. I hope this information is suffice in answering your query. Again, let me know if you need any further clarification in the form of comments below. And also there seems to be an image-based question on thyroid scan Graves' disease. As you can see, the illustration's left side, normal scan, right side, Graves' disease, the thyroid scan in Graves' disease. So first of all, Graves' disease, as you know, it's an autoimmune disorder that causes hyperthyroidism or overactive thyroid. So greater uptake of iodine, as you can see. In case of thyroid scan, it shows how and where iodine is distributed throughout the thyroid. With Graves' disease, the entire thyroid is involved. So the iodine shows up throughout the gland. So overactivity or hyperactivity as evident by the thyroid scan in case of Graves' disease. Now let's move on to the next topic. Various planes. These are the keywords I received, sagittal, coronal. So looking at this illustration, we can see various planes in general. And also, if you need any specifics to let me know. So you can see anterior plane, posterior plane, superior plane, inferior plane, frontal plane, sagittal plane, transverse or transaxial plane, right? So do let me know if you need any further clarification with respect to planes. And then branches of orthodontics, those are the keywords which I received. So as you can see, there are preventive, interceptive, corrective, and surgical. Preventive actions taken to preserve the integrity of what happens or what appears normal for that age includes procedures undertaken prior to onset of malocclusion in anticipation of a developing malocclusion. Prevention is always better than cure, isn't it? Interceptive procedures that are undertaken at an early stage of malocclusion to eliminate or reduce the severity of same. Corrective procedures undertaken to correct a fully established malocclusion. Surgical procedures that are undertaken in conjunction with or as an adjunct to orthodontic treatments, various branches of orthodontics and their objectives. Moving on to penultimate topic, T-Rex appliance. It's one of the modifications of pendulum appliance. Let me know what the query was in specific, pendulum appliance or T-Rex in specific. So as you can see, it's a T-Rex appliance used for displacing molars and expanding arches in 2 phases. It's made of beta titanium wires 0.032 mm as we discussed previous, and also you can see expansion screws. Okay. Now moving on to the final topic of this video, forceps rubber dam. So you can see forceps here, bottom left illustration in this entire rubber dam kit. So rubber dam kit as such has several components which include rubber dam materials, rubber dam clamp carrying forceps, rubber dam punch, rubber dam frame. So you had literally 2 questions from this very same illustration or from this very same topic. Rubber dam template, widget cords, dental silk floss, rubber dam napkin, right? So these are some of the topics which I wanted to highlight in this specific video. Yes, as a life process, as humans, we all have challenges, and with courage in heart and smile on face, I'm sure we can face anything that matters, anything in life. Always keep smiling, but with courage in heart. Keep giving your best and take care of your loved ones. And most importantly, please take care of yourself. And you have any further keywords, do drop them in the form of comment, or you can get back through mail as per your convenience at proudtobedentist@gmail.com. I wish you all the best. Love you all.